Okay, who's next? Come on in. That's a cool one. Here for your panel over there. Oh, you hear from there? Alright, some windows open here. Got it. Oh, sorry, my hair's a little messy. I should wear it this way. So we're that way. Different look. But anyway, so we're hold on a second. We're bringing you out here because we have we lost the AC, and so one AC's down and we don't have enough to do, so making do. So we're inside our hospital emergency tent. So we deploy the hospital emergency tent. Hit the button, up pops the tent. So we have one of these now. Okay, we have emergency power in here as well, emergency lighting. So what do you need? Do you want to do a medical exam, or do you want a cranial? You know, we can do either one. We're scheduled for 2 out here today. A storm might come, so we don't know how the tent's going to survive the storm. Okay, but anyway, we'll do a medical first. Okay, and oh, you outside? You might as well. You can go back in your car, or you can wait. You're next. A little early. I don't know what time it is. Oh, let me see. Okay. We'll be back soon. Yeah. This is the emergency room doctor. We're on the emergency tent. Okay. There's a patient going to be coming back towards your way, so he's scheduled later for a cranial nerve. Okay. Okay. Let's check you out. How are you feeling today? We have cooling, as you can see. Okay, so we have cooling right here. Don't worry, it's not going to be that bad. Okay, it's run on solar power. Okay, all right. Can I get your first name? What's your first name? And your middle initial? And your last name? Your date of birth? Okay. What is it? Month, date, and year? Okay, so you gotta look at me this way. Okay. Great. Last 4 your social? You might not have your first. What's the first one? And the middle one? Alright. Have you been here before? It's your first time here? Hang on a second here. 1 second. I'm okay. Can you see me clearly? Okay. Yeah, I do have extra lighting. Hoping I'm coming out too dark. Okay, that's good. I think that's alright. Alright, now, do you have the chills? Do you feel cold or anything? No? How about fatigue? You feel fatigue? Yeah? Any fever? No? Let's see, let's check your hearing. Can you hear that? Okay, how about this side? Good. No hearing loss. I thought that would be. Okay. We'll have to skip that one. Let's check that visual on you. Okay. I need you to look up. Let's follow my finger. Okay. Put my gloves on here. Hold on. Okay. Here, let me check your hair. Hold on a second here. This hurt? No? Okay. So you got no pain or anything here? Can you smile for me? Frown? Okay. Wink? 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 Okay. Can you feel this on your arm? Hold on, let me see. On your elbow, below your elbow. Here. Oops, missed. Below your elbow, above your elbow. While you're standing there, let me see how tall you are. Okay, you're 5'9", is that correct? No, you couldn't be any taller because the ceiling is not that high. Here, yeah, yeah. I'm not kidding. You have to crouch over. Well, okay. We have a chair for you. You can sit right there. Okay. You should be sitting anyway. So what brings you in? Is this a regular physical routine? All right, let me check. Okay, I need you to breathe in, breathe out, breathe in, breathe out. Good. Cough. Okay, yawn. Okay, good. Swallow. Okay, good. No, the reason why I had you yawn is because I had a yawn. It's been a long night. You know, without the power and everything, it's kind of rough. You feel cool? I have the blinds down. I should get this one down. Get some air in here. Okay. Tell me if you can feel this. Did you feel that? And that helped you a little bit. That give you a little cool. You felt a little cool? test your. Just put your finger in this. Hold on. Okay, 97 over 40. 97 over 94. Okay, not bad. Okay, check your eyes up closely. Okay, look again. Okay, look directly in. Okay. Look up, look down, look left and right. Okay. Look up, look down, look left and right. Okay. Blink. Look to your left, look to your right. Blink. Okay, opposite eye. Look up, look down, look left and right. Blink. Look to the left, look to the right. Okay, great. Any problems today? Do you have any pain? Okay. Alright. Are you scheduled for the cranial nerve too? Oh, okay. Hold on. Let me make sure of this. Oh. Hey, is this patient scheduled for the cranial nerve as well? Oh, okay. All right, so you're in here for cranial nerve too. But I'll give you a medical first, and then we'll do the cranial, okay? All right. Oh, it's separate? Okay, so the separate. So if you had to go to the restroom or something, get a bottle of water for everybody inside. I don't have any here. So it's a last minute thing. But we gotta get, like I say, the show must go on. All right. Are you having any chest pains or anything? No? You feel that back there? Give you a little steam. You feel that? Okay, we're able to, can you smell that too? Okay, so you heard what? A plane go overhead. Good. Can you feel this on top of your head? Felt that? Okay, good. Do it this way. Felt that? Okay, great. Okay, I can see. Okay, now, do you suffer from any lower back pain or anything like that? Have you gone to a chiropractor lately in the last 6 months? No? How about an eye doctor? Have you seen an eye doctor in the last 6 months? No? How about the dental? Let me check your mouth. I need you to open your mouth wide. You should see a dentist as soon as possible. Any pain in the mouth? No? Okay. Can you feel this? How about here? Feel that? How about now? No? How about now? No, you don't feel that? Okay. Okay. You felt it. You had to feel that. No, you didn't. Oh, you felt it now? Okay. You didn't know you had to feel it? Yes, you have to feel it. You feel that? Now you feel it. Okay. All right. Now I'm going to do some vibration on you. Okay. Felt that? Now? You felt that? Okay. How can you hear this? When we do the cranial nerve, it's all standing up. Okay. You should be able to get by that. Okay. So that's a little different than this. Do you feel like a stomach upset or anything like that? Do you have anything like that? No? Okay. Let's see. You see that? Temperature. Internal. Okay, again, 99. Oh, a little high. When you're outside, it's hot. It's humid. All right, can you read this? Too small for you? How about now? Can you read that? Can you see that? Can you see the text? You hear that sound? Okay. Maybe you can feel this. Can you feel that? This. Can you see it? Alright, I'm going to see if I can move your head a little bit. Okay. Any pain there? No? Can you feel that? Can you feel that? Can you feel this? Feel that? Okay, looks like you have a little cut on your forehead there. Okay, let's see if we can take care of that for you. Okay, I'm gonna. Looks like you have a cut here on your arm as well too. How'd you get these? I'm not too sure. I'll put this right here. Seems like they have a lot of scrapes. Did you go through a thorn bush or something? I'm not too sure. Alright. Put a little antiseptic on this. Antiseptic, okay? Now these bandages are waterproof. Okay. Oh, how do you take them off? Oh, carefully. When the time comes, right, you'll know they'll eventually slip off. Whoa. Okay. Can you feel that? Oops. Sorry. Basket over there. Oh no, we're really in a tent. Yeah, this is a real. This is not. This is not fake. This is real. We're really outside in a tent. Yeah. Okay. Show you a little greenery. I don't know if you can see that side. You see the trees? Yeah, this is outside. I'm not kidding, it's outside. You can actually cut a little bit of there, get some air from there. Oh, then it spoils. Got a lot of mangoes. Would you like a mango? They're not going to be cold. Yeah, there's a lot of mangoes out there. I should bring one in and you can tell me what it is. I already told you. Got a lot. It's mango season. Enough to feed everybody. Alright, let's see. I have a cut up here. Let me put something up there for you. You gotta be careful with a thorn bush. Can't take no shortcuts around the hospital. There you go. No, I don't have no other color. It's only white. Well, there's transparent, but I don't have any transparents. Cool, because you can't see it. You don't know if it's there or not. Alright. Do you have anything else I should be aware of? Okay, stand there. I'm going to weigh you. 1, 2, 3. Okay, one more time. 1, 2, 3. Okay, I want to take an x-ray of you. Okay. Okay. This stand like this in the camera. Stand like this. Turn your head completely around so you're facing your back. Okay. Now turn this way. Okay, great. Okay, took front, left, right, and rear. X-rays. What's your insurance company name? Oh, Liberty. And your what's the ID number for your insurance company? Okay. Okay. Cool. Hold on, let me check. Gotta check that in. Hey, hey. Hey, okay, they got Liberty Insurance. Alpha, Beta, Charlie, Alpha Caesar. You just need, oh, you need the last 4. Alpha, Beta, Charlie, 00. Got that? Okay, Liberty? Alright. Okay. Oh, okay, they're good? Okay. Okay, you're good to go. That's... Okay. Oh, no, you can't leave yet. Are you thirsty or anything? You must be thirsty. I'm gonna go in and get some liquid and come back out and we'll do the next exam, okay? Now you can take the next. We have another. There's another person after you. Yeah. Can you see this image? Okay. Cool. Okay, great. Okay, can you see that image there? What do you see? What's that? Is that a human or a cat? Cat? Okay, cool. You see that? What is that? Oh, what do you think it is? Dog? Close enough. Oh. What do you think this is? Dr. Albert. Hey, that's me. How you doing? Nice to meet you. Okay, well, kind of finishing up. Do you have any questions for me? Well, the medical exam isn't that long. Did a lot. The cranial nerve is more detailed. We'll be doing that in a few. Okay, you feel that? Check the eyes again. Or you want me to give you something for the pain? What pain do you said you had no pain? Oh, well, I don't really have anything like that. I put some antiseptic on here because they're outside. Do you wear glasses or anything like that? What letter is that? Okay, so, and this? And what are these? What does it say? And that? Okay, good. Alright, if I had $20, I gave you 10, and I took 5 away from you, how much would you have left? Okay, good. I've had 16 apples, and I gave you 1, and I took it out or 1 away from you. How many would you have? That's right, none. Okay, that's good. Okay. If I'm baking an apple pie, what am I baking? Apple pie, good. If the house is green, what else is green? That's right. Grass. If I say blue, what else is blue? Okay, good. Very good. What is an emergency room? And what do they do in there? Right. What does an operating room do? What does OR stand for? Does that stand for operating room? And what do they do there? Operations. Good. What does a family doctor do? Or you might know it as a GP, general practitioner. And oversees the same thing. I gave it away. Okay. Yeah. Okay. If we didn't have electric, what would we have? That's a tough one, is it? Okay. If you cook with blank, what are you cooking with? You could say electric, gas, propane, electric, and this electric, radiant. Those are the choices you can do. Okay, we're gonna wrap this up, get down to the nitty gritty here. Running out of paper here. I was gonna do something with you here. Did a little observation on you. So I basically gave you a little cranial nerve, but I did a little observation on you to see how you are. This is the first time you're doing this tent routine. So, and just to see how you reacted over it. And you did a pretty good job. Okay. All right, I need you to sign your name here and print. Sign. Okay, and you sign. Do you have any questions, folks? I need your doctor's information. What's your doctor's information? the doctor you go see all the time. Doctor who? Okay. And his cell phone number of office? What's that? Mm-hmm. Okay. And his 6th extension? Okay. Any questions before I let you go? Okay. Alright, now to get out of here, it's a little tricky, alright? Well, you just can't, there's no doors, you know. Well, how did we get in here? I'll let you in. Oh, you came on your own. We'll have to keep the bugs out. That's the only problem down here. Bugs to the bugs. Okay. Alright, let's go. Ready? Right. Let me give you an example of how to get out. It could be a little tricky. First, I'm going to get out of the chair. Okay, here we go. Oh. Alright, so I'll come this way. Okay, here you go.